Hello, thank you for joining me today. My name is Cynthia Baker. I am here to present for oral dissertation defense my study titled Organizational Levers for Frontline Healthcare Employee Wellbeing in Long-Term Care. First, an overview of the presentation so you know what we'll be covering today. Problem of practice, organizational context, importance of the study, methodology, findings, and finally recommendations. The COVID-19 pandemic has created high levels of occupational stress within long-term care nursing communities, leading to a negative impact on frontline healthcare employee well-being. Frontline healthcare employees in long-term care experienced increased risk of exposure and severe illness from COVID-19, significant risk of emotional fatigue and psychological distress, and significant mental health concerns. The setting for this field study were long-term care skilled nursing communities that provide nursing care and personal care supports to medically challenged older adults. The sector employs about 1.2 million frontline healthcare personnel and support workers nationally. CNAs, LPNs, and RNs were recruited for this study. And unlike other medical settings, long-term care relies heavily on certified nursing assistants who typically provide 90% of the hands-on care in nursing communities, including assistance with bathing, dressing, and eating. Licensed practical nurses and registered nurses fill most of the frontline direct clinical care. They pass medication and nurse leadership roles. This study is important because the COVID-19 pandemic has created the highest level of occupational stress for frontline healthcare workers, resulting in emotional exhaustion, fatigue, and burnout that cause reduced job satisfaction, high turnover rates, and crisis-level staffing shortages in long-term care communities. This quantitative research study was reviewed and approved by the University of Southern California, IRB. Voluntary participants were requested via email contact with long-term care corporate leaders, social media, and in-person recruitment strategies. The study's 112 participants were comprised of long-term care certified nurse assistants, licensed practical nurses, and registered nurses, who are the direct care providers for residents residing in long-term care homes, are most likely to have unmediated contact with COVID-19 residents and to experience emotional exhaustion, fatigue, and burnout. The survey instrument contained 27 items and was administered online using Qualtrics. Data analysis was completed using IBM SPSS statistical software to conduct power analysis, independent t-tests for effect size, reliability, descriptive, correlational, and exploratory demographic statistical analysis. Atlas TI statistical software was utilized for coding and categorizing open-ended item responses. The data analysis revealed findings for 3 research questions. The findings address research question 1, that frontline healthcare employee emotional exhaustion, fatigue, and burnout were positively correlated with their perceptions of less work effectiveness. Based on statistical analysis, participants' perception of less work effectiveness showed a strong statistical relationship to emotional exhaustion, fatigue, burnout, and a moderate statistical relationship to less work resources. Using a 5-point Likert scale, 1 is never to 5 always, descriptive statistics of less work effectiveness showed that participants regularly felt perceptions of less effectiveness. And participants regularly experienced emotional exhaustion, fatigue, and sometimes less work resources. Burnout was measured using a 7-point Likert scale. 1 would be never to 7 every day. Participants reported they experienced burnout a few times a month or more. To address research question 2 about demographic differences, variables were categorized into work and personal demographics, and an analysis of variance, or ANOVAs, were performed. For work demographic, the participants' number of hours worked each week and the number of years worked in long-term care communities showed a statistical relationship with perceptions of less work effectiveness. Hours worked were associated with emotional exhaustion, fatigue, and burnout, and years worked were associated with emotional exhaustion and burnout. On average, participants who worked 60 or more hours experienced higher levels of emotional exhaustion, fatigue, and burnout, and less work effectiveness than people who worked 39 hours or less. Participants who have worked in long-term care for 2 years or less felt less emotional exhaustion and burnout, and they perceived they had more work effectiveness than all other participants. Gender differences was the only personal demographic that showed statistically significant evidence of association with participants' perception of less work effectiveness. When comparing female and male participants, on average, males reported perceptions of more work effectiveness than females. Gender differences were marginally associated with burnout, but female participants reported higher levels of burnout, on average a few times a month, while male participants felt burnout once a month or less. The findings from research question 3 included data from 2 open-ended survey questions about organizational policies and procedures and supervisor strategies. Each item contained a follow-up question regarding which strategy was most effective. Overall, the most relevant finding that addresses this research question is that participants most frequently reported none, NA, or nothing as interventions that supported their well-being through COVID-19. The frequency of responses for none, NA, nothing for most effective was higher yet. But participants also reported their organizations provided wellness resources and rewards and incentives, and they reported that supervisor strategies focused on support and communication. Organizational levers for employee support were more critical than ever during COVID-19. The recommendations for the study are based on the current study findings and the prior literature, with underpinnings of social cognitive theory. Recommendations include 1. Frontline healthcare employees' access to mental health services. 2. Nursing supervisors receiving the opportunity to develop supervisory and leadership skills through distance training and mentoring. 3. Empowerment strategies for CNA direct care employees. The prior literature shows mental health is an effective intervention to reduce psychological distress and support employee well-being. Prior studies identified that individual counseling and support groups as essential organizational support intervention and as a well-documented and effective intervention for frontline healthcare employees during the pandemic throughout the United States. Findings from the literature support counseling as a preventative intervention for burnout. Common implementation strategies are employee assistance programs, partnerships with local mental health practices, contracting with a telemental health service, or a digital self-help app. Registered nurses are often supervisors in long-term care communities. They're the most highly trained clinical health care providers at a given time, but may go untrained for supervision and leadership. Prior literature indicated the value of supportive transformational leadership and its relevance for reducing employee burnout and improving perceptions of work effectiveness. A nurse residency program is a distance learning education designed to extend and supplement nurses' base education by including geriatric care content and leader competencies with an added mentoring and consultation component. In addition to filling knowledge and skill gaps, effective nursing leadership development can have several short-term impacts, and it can be implemented strategically depending on the long-term care organization's commitment level and staffing needs. And it can improve RN recruitment and retention, and develop nurse leaders who effectively communicate and support their frontline healthcare staff. Because this is a training and mentoring program, the program would need to be implemented with a flexible time frame for completion from 2 to 4 months. The program requires a nurse facilitator and volunteer mentors, so developing stakeholder partnerships and joining a consortium of long-term care communities is a cost-saving strategy. NRP programs are common, and they're found to be effective in post-acute and hospital settings, but they are new in long-term care, and the earliest known LTC program was 2016, and a more recently created NRP in Utah. Prior literature shows that organizations which implement work environments applying employee empowerment initiatives reduce the rate of employee turnover. For example, LTC nursing homes involving nurse assistants in resident care planning experience lower turnover rates. CNAs are the perfect target for empowerment initiatives as they have the most limited opportunity to advance their careers. They're the lowest paid, and their median turnover rate is well above 50%. The value of staffing practices in relation to retention speaks to the importance of CNA involvement, inclusion, being wrapped in, informed, at the table as part of the team, being valued, and their job satisfaction. This strategy could begin with improved communication across functions for improved collaborative patient care, and by training the nursing supervisors, e.g., recommendation 2, flexible scheduling practices, and increased involvement in resident care planning will improve the quality of care and of value to the organization. Long-term care community administrators and chief leadership have expressed public concern about the staffing crisis. I encourage viewers to take the findings from the current study and find pathways to organizational change and long-term care recovery. Millions of aging adults require medical care in long-term care communities. To reduce the staffing and turnover crisis, it is important to strategically align organizational resources with the values of the frontline healthcare workforce. Thank you to my esteemed dissertation committee, and please feel free to contact me with additional questions.